Hi, I'm Brian Myers. I'm a physician assistant here at Kaiser Baseline Primary Care, and I'm here to talk to you again about procedure setup standardization and this procedure we're going to be discussing today is called an I and D. So incision and drainage of, for example, an infected abscess or a swollen sebaceous cyst. These are common procedures done in the primary care clinic, and we want to talk about how you would set that up appropriately for your provider so that they can quickly move into a procedure room or an exam room and perform this and get the patient out in a timely manner. So again, for procedure setup standardization, we have our photo that shows how the setup is to be, and the photo is labeled I and D of an abscess, and this acts like, we've been calling this a visual recipe. So it has all the ingredients that need to be placed out for this particular procedure. In the case of today, I've taken this photo and replicated it on the counter here. You'll see that on the Mayo stand, which is the rolling stand in your procedure rooms, I've laid out a minor surgery tray, and this is sterile instruments that your provider can use for the procedure. I've laid out an 11 blade, which can be used to open up the abscess to drain it, or some providers prefer to use something like a 3mm punch biopsy, which is a circular razor, to create a hole that they can drain an abscess or sebaceous cyst with. So what I want to do now is review the setup here and make sure that we're all on the same page as how to set this up and why we set it up this way. So first of all, with setup, we want to think about what each item needs with it for it to function properly. So for example, our lidocaine with epinephrine that will numb the area prior to the procedure, we're going to need a syringe to draw it up in. After we have a syringe, we'll need a needle, and prior to even drawing it up, we're going to want to wipe off the tops of those bottles, so we need an alcohol pad out. If we draw all this up and we're going to inject it into a patient's skin, we're going to need something to sterilize the skin prior to injecting. And in this case, we like to use ChloraPreps here at Baseline Primary Care. They're easy and simple and work very well. If we're going to be doing any kind of procedure, you want to lay out for your provider gloves. At our clinic, we like to lay out medium-sized gloves for most of our female providers and large gloves for our male providers. After the patient has been numbed, then the patient's wound abscess is ready to be drained, and that's when the provider will be using their 11 blade or their punch biopsy tool to open up the abscess and drain it. Anytime you're going to be draining something, you're going to have a lot of discharge, so we want several packs of our sterile gauze sponge to absorb up that discharge. In addition, after this has been drained, we're going to need to irrigate out the abscess and flush out all that infectious material or sebaceous cyst matter. So in this case, you want to make sure you've laid out a sterile basin and some sodium chloride, some sterile saline that we can pour in here and draw up in a large syringe to irrigate out the wound site, the abscess. Something that we like to use here at Baseline is a Zero Wet Super Shield, and this is a bell-like device that can be attached to these large syringes so that when irrigating, you don't get water or debris spraying all over the wound. It helps control the field that you're working in. Also, when we're irrigating, we like to mix in an antiseptic called Hibiclens, which is a nice, safe, it's not too harsh to the tissue, but it does sterilize the inside of that abscess or sebaceous cyst and help with healing. So you'll add a packet of this to the basin, pour in your saline, stir, draw up, and then we'll be irrigating it out. Your provider may be doing this, but they may ask you to irrigate out the abscess after it's been opened and drained. And all of our LPNs and many of our MAs are trained to do that here. Moving along is after we've we've numbed the site, we've opened it, we've now irrigated it, is now we have to dress this site. One thing with dressing a abscess is we're going to be packing it. So you need to lie out a packing strip so that that can be put into the wound to help absorb out discharge and prevent the abscess from closing up too quickly, because if an abscess closes up quickly, pus can build back up in the site and cause the patient discomfort and have them come back to our clinic for something that they might not have needed to. So we're going to be packing that wound. If we pack the wound, we're going to have a wick sticking out. To adhere the wick down, we're going to need steri strips and a little mastol to hold it down to the skin so it doesn't just pull out. Also, to put the wick, this sterile packing gauze, into the abscess, we need some sort of sterile device. What I like to use is just a simple swab, and then I can use the back end of the stick to push the wick down into the abscess. After the wound's been packed, we're going to need to bandage it, and these tend to drain a lot. So what we're going to do is use a abdominal pad or something like a maxi pad, and we can cut those to fit the site. And then this can go on top of our non-stick gauze, because remember, we always want to put non-stick gauze down first. And we'll also be putting some antibiotic ointment down. And then all of this will be adhered down with HipaFix, which is strips of cloth fabric that are adhesive. And that's how we'll hold the wound. Another nice touch for this type of procedure is to put out a Sharpie, because many times these are infected and we need to draw margins around the site to ensure that the patient knows how large the infected area was today, where the redness was, so that if it expands out of that area, they know to call us. So lay out a permanent marker for your provider, excuse me. And then we also want you to lay out a wound culture with a label stuck to it of the patient, so that we can culture any discharge that comes out and make sure that this isn't something like MRSA. And that will help guide any antibiotics we use. So as you can see, this is the procedure setup. I want to thank you for watching the video, and also as a quick reminder, whenever you're setting up for this, make sure that you do prepare the patient as well by putting them into gowns, putting absorbent chucks down to absorb any of this liquid that we're irrigating with, and making sure that their clothes are protected from the procedure. All right, thank you very much, and look forward to seeing you in primary care.